Not a strong opinion, but I'll tell you something. So I used to do that when I was your age.
Yeah.
You see these fat knuckles?
Yeah.
That's because I cracked them my whole childhood. Yeah. So you want fat knuckles that you can't get your rings over? Then just keep cracking them, and you'll have these ugly old fat knuckles like mine. The story was, you have an opinion about cracking your knuckles. So you just learned this is an minor little detail. Doc has these fat, ugly knuckles. Because as a kid, I popped them like this all day long. My parents yelled at me all the time, stop doing that. Which, by the way, parents, if you want your kid to stop doing something, don't tell them to stop doing it, because that will guarantee they'll keep doing it. Ignore it. Maybe if you're lucky, they'll quit. Thanks for watching. I'm Dr. Paul. Dr. Paul here. We're going to go in and see a young man who happens to have the same name as the older man behind the camera. That guy. This young man has a cough, I believe. We're going to go find out.
There you go.
Okay. So, hey, good to see you.
You too, Doctor.
Been a while.
Yes.
Yeah. So, tell me the story. What's been going on?
So Noah came down with a cough early Sunday morning that woke him up from his sleep.
Today's Monday, so you're talking about yesterday.
Yep,
Okay.
I think 4 or 5 in the morning. He wasn't with me at that time. He
Okay.
came back under my care at like 9:30 in the morning on Sunday.
Okay.
And so I started.
Hi, buddy. It's good to see you.
I started doing what I knew to do to take care of him. We did some homeopathics.
Okay.
What ended up happening was he slept through the night well, but in the morning it was a lot worse. And by about mid-morning he was coughing and vomiting and wasn't breathing very well at all.
Okay.
And so he was breathing down his like on the verge of aspirating. And
So he vomited?
yeah,
How many times? Multiple times.
Yeah.
Was it cough, 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 vomit?
Yes.
Or did he just vomit out of the
It
blue?
was cough,
Always
cough,
with
cough,
coughing.
Yep, every time.
Now, has he done that before?
Yep. We've seen you this time last year for the exact
Same
same
thing.
thing. Yeah.
And, but outside of coughing to the point of vomiting, he's not been a coughing kid like asthma or?
Nope.
No, okay. So we're gonna peek in your ears because I got this little light here. See how that light is? That's a good light for looking in ears. This one here is perfect. Let's see the other one.
Can you look that way now?
You're doing great. That one's perfect. Let's see your mouth. Can you open wide?
Like when you
job.
brush teeth. Good job.
Good job. So that looks good. Curious to see how your lungs sound. Listen to your heart.
Take deep breath, Noah. Deep breath. Deep breath.
You blow on my finger.
Blowing Dr. Paul's finger. Like you're blowing out a candle.
Harder.
Blow hard, hard.
Good one. Harder.
Again.
Harder.
Longer. Blow harder and longer.
So you're absolutely right. His lungs sound nice and clear, but you can just hear the rattle up in his throat. This sort of preschool age, especially the 2 to 3 year old age group, the airway here is narrower and smaller than it is for a bigger kid or an adult. So the tiniest amount of swelling can cause sort of collapse. And then you get that breathing through a straw almost. And that's that croupy sound. It's what we call stridor, and it can be both on the inhale and the exhale, but it's that inhale that's so characteristic of croup. So you kind of cough if you take too much of it.
Is that what you sounded like earlier? It's like a bark.
Like a bark and seal bark. So that's the classic croup. It's just from swelling up in this larynx and upper trachea area. And if it gets really severe, kids can get a little panicked, like you're breathing through a straw that's getting too small, and you get air hungry, and that's what you were describing, which in the worst cases can be an emergency. Back when I was in training 30 years ago, it's like a long time ago, Kids were in the hospital all the time for croup. It seems like we rarely have to hospitalize now, partly because we have inhaled moisture, inhaled steroids, and in your case you've got access to homeopathics. You're a naturopath in training, right? So you've got extra tools, which is really cool. When I do an evaluation, I just want to make sure his oxygenation is good, his lungs sound clear, he's not looking distressed, which he isn't, and he's old enough that it'd be highly unlikely that he's going to need to go to the hospital.
Why?
Well, because his airway's big enough compared to a 1-year-old, let's say, that he's going to have a better chance of it not getting so severe that he can't breathe at all, or that he needs help with opening that up. So the treatment for croup is humidification, because all that noise is sort of drying the airway, which makes it worse. So you can run cold or warm humidification. And then the mainstream approach is the steroid, which do you still have enough? Steroids, whether it's prednisone or prednisolone, which by the way tastes horrible, so kids aren't real eager to take it, but it is a potent anti-inflammatory. So you're increasing the inflammation of that airway, which then allows air to move more freely. And really it can be life-saving. A lot of emergency rooms will actually give you an oral dose of dexamethasone, which is intended for injection, but you can give it orally. And 1 dose is usually enough, so they don't even usually give you a prescription. Although there's a percentage of those kids bounce back to our office 2-3 days later, because croup usually lasts 3 to 5 days. So worse at night, better during the day. So he's looking great now. I'm not sure why, except that maybe when you're laying down, things are collapsing more easily than when you're upright. So if you've got narrowing of your airway anyway, you're young, so your trachea is a little floppy anyway. It's not hardened cartilage like older people or adults. That's probably part of the why that it's worse at night.
The natural steroid production is lowest at night. So
there you go. He's fresh out of
I'm freshly licensed.
Basic science. You got your license?
Yeah.
Good job,
Since
man.
April.
That's amazing.
Yeah.
So yeah, that's true. The cortisol levels and all that. Yeah. So that might be part of it as well. Excellent. So, folks, the difference between croup and the other cough that affects young kids this age, which is called bronchiolitis, usually caused by RSV, respiratory syncytial virus, is that is a wheeze. So it's an inhale that's fairly normal, and an exhale that's a squeak. And it can be a mucousy cough. The coughs can be a little different because croup tends to be more dry and barky, bronchiolitis more wet. But if you have to treat anything with bronchiolitis, it's treating the wheeze. With croup, it's treating the inflammation. So that's the biggest difference there. And of course, they're generally caused by different viruses. Croup is parainfluenza, occasionally influenza. Bronchiolitis is RSV. Too much information. I bet my guy behind the camera will cut all that nonsense out. You guys don't need to hear all that. You just want to see this cute kid. Noah, you did a great job. High five, buddy.
Give Dr. Paul a high five.
Low five.
Can you give him a high five?
Fist. You guys share this, like it. Thanks for watching. I'm Dr. Paul.